Now I'd like to welcome Dr. Franz and Mellissa Sager and have them tell us a little bit about themselves with some opening comments. Mellissa, would you like to go first?
Sure, thanks for having me. Like you said, my name is Mellissa Sager. I work at the Tri-County Health Department as the Policy and Intergovernmental Affairs Manager. I spend a lot of time recently working on our local stay-at-home orders, as well as communicating with state and local officials regarding interpretations of the state order. I work with our enforcement personnel to enforce the order, and our call center answer questions about what folks are encountering as we proceed through this public health crisis. So I'm here to answer questions from all of your constituents about what they're experiencing and what questions they have related to the stay-at-home order. Thanks for having me.
Thank you. Dr. Franz?
Good evening, everybody. This is Eric France, F-R-A-N-C-E. I'm the Chief Medical Officer for the Colorado Department of Public Health and Environment. And I've been in my role just a few months now and looked very quickly to Tri-County's own Dr. John Douglas to help orient me to the work that was lying ahead. He's a wonderful thought partner, as are all the public health directors in the metro area. Happy to be here tonight to be able to talk with you all.
Thank you so much. And thank you both for being part of our town hall this evening. We really do appreciate it. So now we're going to move on to our questions, and I'll ask the questions that have been submitted over the last couple of days, and I'll let the member of staff or our guests know which one they're going to answer. So our first question is, as a city, are our cases for COVID-19 low or high? In our city, has there been an outbreak, or are we doing okay given the circumstances? I'm going to turn this over to Ryan Doyle.
Hello, everyone. My name is Ryan Doyle. I'm the emergency manager for the city of Thornton. I have the responsibility to help plan for, respond to, and recover from disasters, both natural and man-made. So I've been monitoring the case numbers for this incident on a daily basis since it began. Thornton had its first positive case of COVID-19 on Wednesday, March 18th. The following Wednesday, March 25th, we had 6 cases. And then this past Wednesday, April 1st, we had a total of 41 cases. If you look at the total number of cases amongst the top 10 largest cities in the state, Thornton is actually on the lower end of the case numbers, having half as many numbers as Lakewood and Arvada, but a little bit more than our neighboring city, Westminster. So just from the general numbers, I can say that we are about average statewide, maybe even a little below average on our numbers. But it is important to remember that these numbers are known as lagging indicators. They're really only a small percentage, anywhere from 5 to 10% of the actual number of cases that were infected a week to 2 weeks ago. So currently we could estimate that the city might have anywhere from 200 to 400 cases out there. And our ability to test large populations is still very low. So it's still important to remember that that the stay-at-home order is really out there to help us mitigate the spread of this virus. And although we might be on the lower end of the case numbers statewide, it's still important to remember that that's not a true indicator of our virus numbers. Unless potentially Dr. France, if you might have anything else to add.
No, I think that was well said. You know, if I just point out that we have a website at the state, covid19.colorado.gov, I believe is the address. And we have a map, and it will show, at least by state, county level, what the incident rates and the number of cases are, and they'll be kept up to date there. We like to compare a rate, number of cases per 100,000 population, and I believe Adams County and Douglas County are both at around 50 cases per 100,000 population. Weld County is double that at 100, and I think Denver is about 90 per 100,000. So I think, just as you said, average to below average for Thornton.
Thank you both. So our next question, I understand why we need to stay in place, but experts are saying that this is going to be around for a while until a vaccine is developed and we can't stay inside forever. So when will we be able to resume normal life? And when will the governor lift or extend this? And what will be the basis for his decision? Dr.
Well,
Frank.
I'll be happy to start on that, and maybe Mellissa has some ideas as well. Yes. Well, I think you all understand that this virus is spread from human contact, and just like my plants will wilt if I don't water them, this virus will wilt if it's not having connectivity between people. So physical distancing, we used to call it social distancing, but now we really want to call it out as physical distancing, because socially, I hope we're still staying connected. Physical distancing is going to be a big help. Our estimate is that by having us all stay at home, we're reducing the transmission of this virus by anywhere between 60 and 80%. That kind of dramatic reduction in spread means fewer people will be walking around, spreading it to others, spreading it to vulnerable populations. And of course, the driver for all of this is that we don't want to overwhelm our hospitals, the ICU beds, the ventilators, and the best way we can prevent overwhelming them is by reducing how much this spreads. How long will we have to stay home? Well, certainly we can't have an economy, so this can't go on forever. I know the president as well as our governor want us to be home through the 30th of April. We'll be monitoring the number of cases that are occurring, the number of people hospitalized, the number of people in the ICU over the coming weeks. And if we see, as we hope, a reduction and a drop, we'll be able to consider loosening up our ability to get out and have business as usual. Once we start to relax these public health orders, it will be a matter of having more testing done, more aggressive identifying of cases, isolating them at home, putting their contacts in quarantine, and having to live in a world where, while we're allowed to get out, we also have to really pay attention to, try and control any little outbreaks that we find. It may be, for instance, that Pueblo has a bigger outbreak, and the governor will say, if you live in Pueblo, you have to lock back down again for a period, while the rest of the state might be doing okay, or it might be Denver, or it could be Thornton that would have such an outbreak. So it's going to be a bit of a back and forth as public health ramps up its ability to do testing, and then ramps up its ability to go out and contact people who seem to be ill, make sure that they are isolated and quarantined so that we can try and keep the spread of this virus to a minimum.
Thank you. Our next question, is there a recommendation for the public to wear masks when they go out in public, and will cotton masks made at home be enough? Dr. France?
Well, that's a good question. It's actually a question I've been reading about today, and you might have seen it in various newspapers that might have helped you think of why this is important. So wearing a cotton cloth-based mask may help prevent me spreading it to you. So I'm the one wearing the mask, and it turns out I'm sick and I don't know it yet. Today is Thursday. Maybe my destiny is that I'm going to wake up Saturday morning with a fever, cough, and clearly within a few days I have COVID. But actually on today, Thursday, I am without symptoms, but the virus is growing in my nose and throat. I could be going out and spreading it to people and family members. And so the CDC is looking at whether we should be wearing cloth masks when we go out into the community, not so much so that I don't get sick from you, but just so that I don't get you sick if I happen to be sick and don't know it just yet. So The issues, I've actually reached out to our local public health agencies, including Tri-County, and said, what do you think? Are we getting close to recommending cloth masks for everybody? The thing that people were most concerned about as I connected with them was that this could lead to a run on the traditional surgical mask that you see nurses and doctors and other healthcare providers wear. And those kinds of surgical masks absolutely need to stay in the hands of the healthcare workers right now, and we cannot afford a run on those kinds of masks. If though there's a book club or your son or daughter likes to sew and decide to make some cloth masks, wearing it outside may potentially help you from actually infecting somebody else should you be sick. The other thing that is noted is that when people wear masks, they tend to physically distance a little more than when they don't wear masks. And so it may be kind of a way of enhancing our physical distancing call to actually have people go out with a mask. So my conclusions as of today are, one, I'm going to wait to hear if over the next few days does the CDC come out with a strong recommendation that we all wear masks outside. Two, I would be open to the idea that if you are going and you want to wear a cloth mask, then by all means wear it. And you're doing it again as a citizen trying to protect others, should it turn out that you're actually sick and you didn't know it. And thirdly, I would ask you not to buy surgical masks to wear outdoors like you sometimes see on different news items from Asia, because we need those surgical masks in our hospitals and clinics for our care providers at this time.
Thank you so much. That's really helpful. I know there's a lot of groups out there that are making masks, and I think this will be a good use of their time. One more question for you, Dr. France. Are you satisfied with the mandates from the state, or do you feel more is needed to contain the spread of the virus?
Well, we are, I guess, when we got to if you look over the last 2 weeks, of course, you saw all these steps. And I have to say it was a challenge for us to go through all those steps. Should we close the restaurants? Should we reduce gatherings to 250, then to 10? Close the schools? What is the science? What do we know? And it was a lot of hard work to figure out what triggers we ought to pull. I think now, looking in other communities that, like San Francisco and Seattle, where they did these sorts of things early, and they're starting to see some flattening of the disease, we feel a little bit better that we pulled the right levers at the right time. And if anything, I'm a little nervous that am I getting too complacent? Are we too complacent? Because now, of course, our focus is on building out hospital beds and making sure we have enough ventilators and ICUs for what might be coming. And in that work, we're not creating new social distancing rules. I am happy with where we're at. We track information from like traffic patterns, for instance, and we've seen traffic be reduced by 50% on average during the weekdays and maybe 40% over the weekends. Our hope is to continuously emphasize the message to stay at home, to create that physical distancing, because that's really what's most important, so that our doctors and nurses and first responders are not overwhelmed in the weeks to come. Are there other things that we need to be pulling, or new triggers, or even more stringent interventions? I don't think so just yet. I would say finally that as we track cases every day, we look at our case counts. And I think we had about 380 new cases today. We had about 370 yesterday, 350 to 30 or something the day before. And if you look over the last week, we've been sitting at about 300 to 400 new cases a day. The good news is that it's not going 300 on day one, 450 on day two, 700 on 1,400, 3,000, 5,000. So in a typical epidemic, those are the kinds of exponential growths you would be expecting. So the fact that the cases don't seem to be going up to such a high speed is reassuring. And the hospitals, too, are saying that the time it takes to double the number of people coming to their hospital originally was only 2 or 3 days, but now it's almost 6 days before they're doubling their numbers. So all that was a long-winded way to say it seems like our stay-at-home rules and the rules we've been putting in place are having an impact at slowing the spread and transmission and flattening the curve. And so I'm feeling good about what we've done to date, and I'm not feeling like we need to do more. If we saw all of a sudden the kind of explosive growth at the hospital like you hear in Italy, then maybe we would have to become even more strict with stay-at-home rules.
Thank you. Our next question. I work in childcare and got laid off earlier this week, and my husband also got laid off last week. We have a toddler and a 6-month-old baby, and we don't have money for our April rent, bills, and barely enough food for the coming weeks. What options are there to help us with food and bills and rent? Jalen Stotler, would you please take this one?
Thank you, Mayor. Good evening, Thornton. I'm Jalen Stotler, the Community Connections Manager. Community Connections is your go-to spot for resources, and we are here to serve you. This is definitely a trying time for our community, and I am sorry to hear about the recent job losses our community is experiencing. We want to help. So first, I would encourage those who have lost their jobs to file claims for unemployment. The unemployment insurance program offers cash assistance when a person loses their job due to no fault of their own. You can start that process by visiting www.colorado.gov/CDLE, as in Colorado Department of Labor and Employment. If you do not have internet access, you can call 303-318-9000 to start your claim. Please note that the Colorado Department of Labor and Employment is experiencing an unusually high volume of calls, so you may receive a user busy notice. Keep trying. Regarding rent and utility assistance, Community Connections oversees a funding stream called Community Development Block Grants, or CDBG for short, and some of those dollars do go to our partners to provide rent, mortgage, and utility assistance. We have checked with our partners that we contract, and they still do have dollars to spend. We are working on possibilities to send even more funding their way. We're also keeping in very close contact with our local food banks. We know that a lot of our community members rely on food banks, and we're staying current on their levels of service. Please reach us, and I'll give you our phone number and our email address at 720-977-5800. Email is connections@thorntonco.gov so that we can point you to the resources available in your area. Our food banks are spread throughout Thornton, and we would want you to go to the one that's closest to you so we can provide that personalized service for you.
Thank you, Jalen. I know the work that you and your department is doing is critical right now, and we really appreciate you. And our next question, I'm a small business owner in South Thornton with only a few staff. We're closed because we're non-essential, but I can't stay closed for much longer. I need revenue to stay afloat. I don't know if I qualify for any federal money, and where do I find out if I'm eligible? When can I expect money? And if not, what options might the city have for me? I'll turn this over to Robin Martinez.
Thank you, Mayor. My name is Robin Martinez, and I'm the local business administrator with the Thornton Economic Development Office. First off, I'd like to say my heart goes out to our Thornton business community as we are going through this unprecedented and uncertain time. Just want to say our office is here to support you however we can. The information I'm about to share can be found on our website at www.businessinthornton.com. And on the front page, you'll find a link for Pandemic Assistance Business Resources. So the Small Business Administration, also known as the SBA, has 8 different disaster assistance programs. They have loans, debt relief programs, and grants designed for businesses as small as a sole proprietor or private contractor on up to companies with up to 500 employees. The funds can be used for a variety of uses such as payroll, working capital, rent, utilities, and more. You can find an overview of each of these programs on our website, along with a link to a more detailed document provided by the U.S. Senate. The SBA is already accepting applications, and depending on the program you are applying for, I've been told that once your application is accepted, it will take approximately 2 weeks to receive the funds. Some of the other programs, such as the SBA Express loans, are available immediately. So check with your bank to see if they're an approved SBA lender. We also partner closely with the North Metro Small Business Development Center, also known as the SBDC. They provide free one-to-one counseling and technical assistance for business owners, as well as education workshops on topics such as accounting, marketing, and HR. In response to COVID-19, they are helping business owners navigate through various SBA loan programs to understand which loans work best for their individual circumstances. They will also help you complete your application, and their services are available in English and Spanish. Our Thornton Economic Development Office recently sent out an email requesting Thornton businesses to assist us by completing a survey on how COVID-19 is impacting their business. We're capturing this information to help our business commissioners and city council members understand what resources are necessary to assist our Thornton businesses. We have sent the survey in English and Spanish, and you can also find the survey on our website under the Pandemic Business Resource link. The survey will be open through this Sunday, so please take a moment to fill it out if you are a Thornton business. Our business commissioners and our Spanish-speaking business advisors are working with staff to create a business emergency grant for small commercial businesses licensed in Thornton. The emergency grant will be available by mid-April. And last but not least, our Economic Development Office is assisting with marketing and exposure efforts for Thornton businesses through our Thornton Economic Development social media pages. Residents and businesses, please follow and like us on Facebook at OED Thornton to learn about some of the great businesses in our community and how you can support them during this difficult time. To get the most recent updates on our efforts and the community resources available, please stay connected with our office. All of the information I have shared, plus our website, you can also find my contact information under the About Us tab. Robin Martinez, Local Business Administrator, at www.businessinthornton.com. Thank you.
Thank you, Robin. I know our businesses are kind of our lifeblood in our city, and I know they're hurting, and I really appreciate the work you guys are doing to make sure they have support.
Thank you.
And our next question, what specific steps has the city taken to support seniors, and how is the city informing seniors of available resources? I'll turn this over to Lisa Rinaldi.
Thank you, Mayor. Good evening. This is Lisa Rinaldi, and I am the Older Adults Program Manager. Thank you for your question, and thank you for your concern for older adults in our community. As a way to reach out to our seniors in the community and to help reduce isolation and loneliness, our team has been providing friendly visitor check-in calls to seniors in the community. We've placed over 650 calls, and staff have really found that most seniors are doing pretty well. In fact, many of them have set up phone trees and with others to stay connected. For those needing resources, we are prepared to connect them to the needed resources and services. We're also closely connected with our providers in the community. One such provider is the Senior Hub organization. These folks provide the Meals on Wheels program. throughout Adams County and are currently serving 93 seniors in Thornton with daily meal delivery. This organization is also helping with grocery shopping, hosts a food bank, and provides some in-home care services. Transportation for our older adults is continuing through A-Lift and FlexRide. A-Lift's priority is medical and grocery shopping transportation. However, this group is also opening its service here soon to include grocery delivery, medication pickups, and frozen meal delivery service. We also meet weekly with providers of services throughout Adams County. It's really important to stay connected to what needs are out there in the changing face of service delivery during the COVID situation. And finally, as council has mentioned in their comments, the city really supports and promotes this idea of neighbor-to-neighbor connection. And staff are really encouraging neighbors to check in on their older adult neighbors, offer help. We've heard many positive stories about neighbors caring for those in need, and it really is the key to helping folks. Thank you.
Thank you so much. I love what Dr. France said earlier, that this is more about physical distancing and less about the social distancing piece as we stay connected. In the next question, I've been pretty proactive about checking on my neighbors to see how they're doing, but I want to do more for my city. The state's asking for volunteers, but I'm not concerned about them. I want to help my city. What can I do to help? And is the city recruiting volunteers to help within the city? I'll turn this over to Elisa Zimmerman.
Thank you, Mayor, and hello, Thornton. I'm Elisa Zimmerman, Arts and Culture Manager, with some information for you. But first, thanks for checking on your neighbors during this time and wanting to do more for Thornton. We'd love to hear that. I've listed some more ideas on the slide that you can do on your own to help, like picking up trash, helping with meal deliveries to those in need, or donating supplies to local nonprofits, and much more. If you'd like to participate in a neighborhood project like a food drive or trail cleanup, partner with your local place of worship, a service club, or even an HOA to help coordinate and promote this. Use social media like Nextdoor, Facebook, or Instagram to get the word out so your neighbors know what's going on and how they can help. If you're interested in doing even more beyond your neighborhood, contact Thornton's local food banks directly to see how you can help with their donations and deliveries. Many of these food banks are listed on the city's Community Connections webpage at thorntonco.gov/community-connections, or call 720-977-5800 for more info. Also check with the Adams 12 5-Star Foundation at 5starfoundation.org, which is asking for financial support to make sure all students have equal access to meals and technology to support online learning at home. Thornton is also served by 2 other school districts, Mapleton and Brighton 27J, so reach out to their offices too to see if they have schools in your area with specific needs that may not be listed elsewhere. To find out about even more volunteer opportunities, but all in one place, visit helpcoloradonow.org. You can register as a volunteer at this website to be matched to a nonprofit based on your interests and availability, as well as make financial contributions, donate blood, or needed supplies. The choice is yours. With all these volunteer possibilities, we ask that you continue to keep your own health in mind, with frequent hand washing and physical distancing while helping others. Thanks so much.
Thank you. And also remember, when you're volunteering, to make sure you're keeping yourself and others around you safe. And whether that's using a mask to make sure you're not spreading anything from yourself if you have no symptoms, or making sure you stay home if you do have symptoms. On to our next question. Fire, police, and trash are out every day helping. How do I help our city's first responders and other staff? Should I be making masks, or can I give them food? I'll turn this over to Fire Chief Gordy Olson.
Good evening, Mayor. Good evening, everyone. I'm Gordy Olson, your fire chief. So your question, fire, police, and trash, and really there are many more employees working, employees that we call essential employees. and they're here every day making things happen. So your question, what can you do to help them? We absolutely appreciate your gratitude towards wanting to do something to help those people that are still coming in to work to provide those essential services. We are doing okay right now. Our council and our city is well supporting the needs that we currently have. But we will certainly reach out to you should any more needs arise. I do want to take an opportunity to remind people that if you do call for assistance, generally fire and police, and when they arrive, if possible, please send one person out to meet that first responder. And please alert them if there are any sick people in your home, even if they're not the reason that you called for help. This allows us to take precautions to protect you and to protect our people, our first responders. The next question about making masks, I think, was covered very well by Dr. France. Again, we also are monitoring CDC and looking for their guidance on the issue. I think we all expect that it may happen sometime soon because they're actively looking at that issue. Can you give food? Believe me, your generosity is always appreciated. Our firefighters do appreciate those offers. They come often. They are doing fine though, again, right now with the food stores that we do have at the stations. I would say if you really want to drop something off, our health experts are asking that you probably use prepackaged or commercially prepared food. Again, this is for the safety aspect of that. But again, as a great alternative, if you heard from a couple of the council people, and again, since our firefighters are well supplied, we would suggest you also donate to our local food banks because there is always a need there. And I thank you. Mayor, back to you.
Thank you, Chief. Appreciate that. And thank you for all of that you and your staff are doing for us right now.
Absolutely.
On the next question, what is the police department doing to monitor the activities of juveniles who may be out in groups causing problems in the community? Police Chief Randy Nelson, I'll turn it to you.
Good evening, Mayor, Council, and community members. In responding to this question, I'll address it in three parts. First, the City Communications Center is receiving a limited number of reports on youth gatherings. We appreciate receiving those reports and community members' comments. Second, the police department has high visibility in the community, responding to concerns or officers' observations of youth gatherings, specifically addressing these concerns by contacting the youth through our district officers, impact team members, and our youth services unit, strongly encouraging social distancing, responsible and active compliance with the governor's order. As you can imagine, this can be a challenge with thousands of youth in our community out of school. A positive comment here is that the police department has a robust youth service unit and a strong knowledge and connection with a number of our community youth. No enforcement action is being taken at this time with the youth regarding the governor's order. However, and as appropriate, the police department will take law enforcement action on criminal acts committed by youth. An example of this is the Safeway store on Washington Street just the other day had some youth that came into the store intentionally coughing on food items, indicating they had COVID, which required the store to remove up to $100 worth of merchandise from the store. We will continue to actively investigate these type of criminal activities with our youth and bring this to a successful resolution to try to stop this behavior. Thank you.
Thank you, Chief. Appreciate it. And again, thank you to you and your staff for everything you're doing for us right now as well. On our next question, we are encouraged to walk in our neighborhoods, but is it really harmful to drive to an open space or a different location to take our walks? Picnics have been discouraged. If I have takeout food or food from home, am I allowed to sit on a bench and eat outside? Dr. France?
Thanks for giving me a moment to unmute. The principle, of course, is to stay at home so that we create physical distance with others. I was out the other day on a bicycle ride, and I was going to where was I going? I think to my office. I still occasionally work from my office for some essential meetings. And I couldn't help but notice how many people were out. I should be happy as a preventive medicine and public health physician that people are out exercising, managing mental health by enjoying the outdoors. I couldn't help also but ask myself, am I being more exposed, or could I be exposing somebody else if it turns out I'm actually sick right now because it's so crowded? So I didn't really know that would be the case until I got there onto the trail. So it makes me wonder, thinking about going to an open space, will you find yourself arriving to a place where there are many other people there at the open space, and as such, potentially being exposed to the coronavirus and therefore defeating the goal of suppressing its transmission. So I'll just say that the governor's public health order is certainly supportive of going out in your neighborhood, walking your dog, getting exercise in your neighborhood. I think there's some discouragement of driving too far, of crossing counties, because you're not quite sure what you'll find once you get there, and it may be more crowded than you think. So use your discretion. I would discourage you from going off to a park or an open space at this time, but stay close to home instead.
Thank you so much. Seve Ghosh, do you want to add anything to that?
Sure, Mayor, thank you. This is Sevi Ghosh, Director of Parks, Recreation, Community Programs, City of Thornton. Thank you for the opportunity to answer that question too. So we are following the CDC suggested protocol, and as such, our recreation centers, the golf course, our tennis and basketball courts, playgrounds, skate parks, and our dog park are all closed. But our 92 parks and 145 miles of trails are open. And we are encouraging the community to use them while practicing physical distancing. That's important. So thus, if you bring food into the park and sit at a bench and possibly enjoy the meal, and taking in a bit of nature and vitamin N, we definitely approve of that. So all we ask is that you practice the physical distancing and stay safe and close to a park close to your home. Thank you.
Thank you very much. On the next question, why are liquor stores open and shops that sell vapes and tobacco substitutes not allowed to be open? Dr. France?
Well, that's a good question. Grocery stores, alcohol stores, marijuana stores are all open, I believe. I don't think I know about the vaping stores and why they aren't open. So I'm sorry, I don't have an answer for you. Maybe Mellissa or someone else on the line has a better sense of the logic behind that.
This is Mellissa from Tri-County. One issue with liquor stores, particularly are locations that have exempted them, and then to have a location that has not creates additional movement that we're trying to avoid. And so if we were to close liquor stores and marijuana stores that travel into Denver to access that into our surrounding counties would create public health concerns.
Okay, so because Denver has them open, we need to have ours open as well, essentially?
It's part of the reason, and it was part of the factor in the decision-making, yes.
Thank you so much. The next question, are parents allowed to bring their baby or child to their parents' house to babysit while we work? And I think I'll turn that over to someone from Tri-County.
Yep, Mellissa again. The answer is yes. Caring for a family member in another household is considered a necessary activity, and any childcare services, which would include services provided by your family members, are considered critical services. And so you can engage in those activities. We just ask folks to be careful as they do that. Some folks are more vulnerable than others, and older adults in particular are vulnerable. And so being careful to not be out and about and then bringing your children to your parents that may be more vulnerable.
Thank you. Our next question, my license plates expire next month and I need emissions checked. Does anyone know how this is going to work? Todd Barnes, I think I'll give this one to you.
Thank you, Mayor. This is Todd Barnes. I'm the Communications Director for the City of Thornton. Thankfully, I didn't have to stand in line at the DMV to find this. I found this on the website, and it basically says that there currently is not an order that waives the need for emissions testing, but because the emissions testing facilities are closed, they now have a 60-day exemption past the end of the governor's executive order. So the executive order, I'm understanding, goes till April 30th now. So they would have 60 days past the end of that to get their emissions done. And you can go online and file for an extension.
Thank you. Our next question, and this one's going to go to you as well, Todd. We've had a series of questions about the food supply and other household supplies availability. Does the city monitor what's available in grocery stores?
This is a situation that changes daily, and any information the city could supply would get outdated quite quickly. So our best recommendation is stay tuned to local media outlets, as they're more on top of the trends, but it will provide you the most current information. They've been saying that the supply chain is catching up with most goods at this point. Thornton does not monitor on a daily basis and can't supply that information.
Thank you. And our next question, what organization is responsible to enforce the COVID-19 orders against businesses that deliberately refuse to close? Such businesses are deliberately endangering both their employees and customers directly. Mellissa, can you answer this one?
Absolutely. A variety of organizations have the authority to enforce, but Tri-County Health Department will be enforcing, taking enforcement action against entities that refuse to close. And I just wanted to do a brief overview of our process, but Tri-County is really focused on education and outreach before taking court action. So we're doing outreach to businesses that we're receiving complaints about. We're then issuing written warnings to let folks know that they're in violation of the public health order. Businesses continue to operate once they receive that written warning of violation, we will issue a written order to close. And so Tri-County has the authority to write orders to close. If they continue to operate after an order to close has been issued, our attorneys at the Tri-County Health Department will bring action in court. That may look like a temporary restraining order to have law enforcement physically close the location, or may look like criminal penalties depending on the violation.
Thank you very much. And our next question, I think, Mellissa, you're going to get this one as well, and maybe Jalen can help you out with it too. What do I do if my landlord tells me that I'm going to be evicted during this time of staying at home?
Yeah, so it's a little bit more of a complicated question. The governor has asked a stay of evictions, but he has not issued a formal order staying evictions. I will note that courts have taken action. So the Adams County courts are operating with reduced staff and focusing only on matters of immediate concern, mostly related to public safety. So they are not hearing eviction proceedings currently. And the current wait time on eviction proceedings is 60 to 90 days past the lift of this order. And so a person would not be evicted right this moment because the courts aren't processing evictions right now. That's not to say that they will not owe that rent or face payment later. And we're waiting, we're monitoring the governor's actions on this as far as a statewide stay on evictions. It just hasn't come yet. I'll also note that Wells County also has, the courts have taken action to not hear eviction proceedings right now.
Thank you. Jalen, can you add to that?
Yeah.
Sure. On the resource side of things, I mentioned earlier that Community Connections forwards some of our CDBG funds to partners that provide rent, mortgage, and utility assistance. We regularly check in with these partners and others to see how many dollars they have remaining. And as of today, they do still have money to support rent, mortgage, and utility assistance. Rest assured, we know how very important these dollars are in stabilizing housing for our Thornton neighbors. And we are hard at work with the intent of finding new ways to bring even more money into these programs. If you are in need of rent, mortgage, or utility assistance, we invite you to contact our bilingual staff at Community Connections, phone number 720-977-5800, email connections@thorntonco.gov.
Jalen, I'll just add that it really is a good idea to seek out those services because, as I mentioned, just because eviction proceedings aren't going forward now doesn't mean that money won't be due later. And so to connect to those resources would be a great idea.
Absolutely. Thank you for that.
Thank you so much. I know this is a topic on many people's hearts right now. On our next question, if I want to go out and pick up trash in our parks or trail areas, will the city deliver trash bags to me? Paul Burkholder, will you take this one?
Hi, thank you, Mayor. The short answer is we cannot supply the trash bags. It's just too hard to coordinate that. But we're more than happy to pick up the trash. Just if you pick it up, leave it by a trash can, and we'll grab it. I want everybody to know that park staff continues to work through this. They're working 7 days a week from 7 to 7 every single day. So all the parks are getting used very heavily. They're critical infrastructure during this time period. So staff is out there working hard.
Thank you very much. So we're down to our last question for this evening. How do we get the information out to those who may not have access to websites? Jalen, can you help us?
Yes, Mayor. We are coordinating both online and offline, meaning non-internet promotion of resources. We know how important they are to the community, and we want to get information out to people in the way that works best for them. So as far as our non-internet promotions, here's what we're doing. Our bilingual English and Spanish staff are still available to serve by phone Monday through Friday from 8 a.m. to 5 p.m. We can be reached at 720-977-5800. On cable channel 8, we have English-Spanish bulletins. You can expect an English-Spanish utility bill insert in your April 20th bill. And to supplement that, we're sending a postcard to our multifamily complexes that don't receive the utility bill. So examples of multifamily complexes are mobile home communities and apartment communities. We also created an English and Spanish hard copy resource flyer, and that lists options for food, mental health, medical, housing, and more. We hand delivered those flyers to a variety of grocery stores and carnicerias, food banks, again, those multifamily housing complex. We also left flyers with fire and PD so that they can distribute them as they see fit. And we posted information on the community bulletin boards throughout Thornton at 3 different locations. One of our partners, Audio Information Network, serves people with visual impairments, and they have vowed to call all of their Thornton clients and read the contents of that flyer to each of their clients to help get the information to them as well.
Thank you very much. Thank you all for participating in this evening. Dr. France, do you have any final words that you'd like to leave us with?
Just my big thanks to the commitment of you all to keep healthy, create physical distance, make sure this virus can't be spreading any more so that our healthcare providers and our vulnerable populations are not affected. Thank you very much.
Thank you. Mellissa, would you like to add anything?
Yeah, just a shout out to all of you for being engaged in this. We really appreciate your support, the support of your constituents. The questions that are coming means that you care and you're trying to do your best to curb this public health crisis, and we appreciate it. You guys are all partners in this, and we'd encourage you to reach out if you have any questions or concerns as we go through this. We're all learning together, and we appreciate you. So thank you.
Thank you so much. And I want to send a big thank you out to the City of Thornton for engaging tonight. Thank you to Tri-County and CDPHE for participating. And thank you to our staff members for helping answer all these questions. I have been so proud of our community for looking out for each other. I'm so proud of our city staff for how hard they've been working. And many of them aren't used to presenting in the public. So thank you all for stepping up and doing this. For those of you listening, either online or live tonight, feel free to reach out and let us know what you thought. We'd love to be able to bring something like this to you in the future. And I hope you have a wonderful evening. Thank you very much.
Thank you, Mayor.
Thank you, Mayor.